Breast cancer risk assessment is an algorithm in which we collect data. So all those questionnaires that you fill out when you first come to our office, we actually use that data to look at both modifiable, that means changeable risk factors, as well as non-modifiable risk factors like your age and your breast density, things that you can't change. And when we put all of that information into that algorithm, it tells us whether or not you're at below average risk, or perhaps above average risk. So there are lots of things that can put one at higher risk. Number one is having a family history, and that's the one I think people hear about most of all. But, having a family history of a grandmother that had breast cancer at 80s is not the same as, for instance, having a family history of a mom who had premenopausal breast cancer. So we're looking for multiple relatives, both first and second degree, younger age of onset, but there are other things that can increase risk. For instance, having your periods at a young age, and those women who are menopausal, having their menopause age be at a later age. So that's a longer period of time that their bodies are exposed to their own hormones. Having a biopsy with atypia, or what we call hyperplasia, which is the ducts are very active, almost too active, can put someone at a higher risk. And having dense breasts can put someone at a higher risk. I think the best thing someone can do is seek out the care of someone like myself, who specializes in the high-risk population, and sitting down and finding out what's the level of risk, and then also discussing with the patient what their level of tolerance of risk is. And so sometimes a woman would just want to see someone more frequently, like maybe twice a year, and do additional imaging studies, for instance, like a breast MRI. And sometimes the risk is high enough and their tolerance risk is low enough that they might want to take a medication, or particularly in people with really high risks like the BRCA gene, they might want to consider preventative surgery. So these are things that have to be individualized to the patient, and someone who is well versed in taking care of these type of patients can make appropriate recommendations.